Babugeli Emakaya, good evening. Siyanibingelela nonke once again. Kulo uhlelo lethu esilithanda kakhulu holistic healthy living. Wow, wherever it is that you are watching us right now is probably one of these platforms. Siyatholakala live on GNF TV. Nisithole futhi ku GNF Ministries Facebook live page kanti futhi nago YouTube siyatholakala yilo ihlelo lethu esilithanda kakhulu holistic healthy living lapho sifundisana ngezempilo. Remember, your health is your responsibility, and you watching us right now is one of the steps that you are taking in the right direction. Now August is Women's Month. So sizobe sifundisana kakhulu ngezempilo mayelana nabantu besifazane. Babukeli emakhaya. Today we have a powerhouse. Makumele ukuthi uyobona this kind of a doctor. Uhlukana nemali mingabi, and we are bringing him live to you at the comfort of your own homes, free of charge. Yo, it doesn't get any better than this. And now this is the time before sizongena endabeni yethu, before ngizonintroduce kuye udokotela esihamba naye namhlanje. It is the time to tell your friends, to tell their friends that holistic healthy living is live. Let us share, let us like, asibukeleni, askipe nama notepad. Angithi niyazi ukuthi siyafunda njena. So, babukeli emakhaya, I have with me Dr. Nakanyane. Abanye mhlawumbe uyamazi, mhlawumbe umazi, if bongamazi sozomazi. Ku Twitter uyatholakala lapha as Dr. Nax. Yes, it is him. Dr. Nakanyane, hi. Welcome.
Thanks for having me.
How are you today?
I am good, and yourself?
I am very well, thank you. Now, you are very expensive. We can't just umuntu makayobona an obstetrician, obs and gynae sihlukana neimali eningi kakhulu. How does that make you feel?
Wow, okay, that's a difficult one. I find myself in a space of helping people, right? It's not really about the cost that comes into your health. It's just about me helping you with whatever it is that you come to me with. For example, a pregnant woman that comes to me for assistance and just to see them through their pregnancy, take that journey with that couple up until the point of delivery, make sure that she delivers a healthy newborn baby. If there's a need to deliver by C-section, we do so. If we're going the normal route, we go the normal route.
Okay.
It's really just a matter of me being present and being able to assist those that need my services.
I love that.
Yeah.
Babukeli emakhaya, now before sizongena endabeni yethu, I want you to get to know udokotela wethu a bit. You look rather young to be a specialist. Kakhulu sisakhula, a specialist begula yabona labo doctor laba esebahamba kanje, like they were elderly. No, I don't want you to tell us your age. Don't worry. I just want to understand. Gambela, you're a specialist.
I am, yes.
Okay. How long does it take for one to be a specialist?
It actually takes some time. It took me longer, actually, if you must know.
Why?
The journey starts from medicine, right, from undergrad.
Okay.
By that time, many of us actually don't even know what we want to become. There are certain people that start medicine first year, they already know, I'm going to be a pediatrician, I'm going to be an obstetrician, I'm going to be a surgeon, whatever. But many of us discover what we love along the way.
All right.
And that was pretty much my journey. I will say, when I say it took me longer, I spent a few years longer in undergrad.
Okay.
So I had to repeat a few years.
Okay.
On top of that, so generally most medical schools in South Africa, 6 years.
Yeah.
Where I went in Bloem, it's a 5-year course.
All right.
Did that in 7. On top of that, I had 1 year of BSc before.
Okay.
So I was in varsity for a good 8 years
Sure.
before I started, right?
And I can imagine at that time your peers that you started with, maybe in different fields, they are working, they making money. How was that? Were you pressurized
Yes.
at any point?
Yes.
Of course.
I don't think there's any doctor that has been through medical school and they'll say they were never pressurized. Even your straight A distinction students, they still had their pressures. We all had different pressures at different levels.
Yeah.
But yeah, you just push through, you focus, and then you get to your goal.
And here you are.
And here I
you
am.
are
And that's
a
just the
specialist.
beginning of the journey, right? Because after that, you get your degree. Let's say you do it in 6 years.
Yeah.
You get your degree. After that, there's a mandatory 2-year internship that you have to do. You're allocated a hospital. You do your 2 years of internship.
Yeah.
From there, another mandatory 1 year of community service. So that's already 6 plus 3. That's 9 years, right? How I looked at it from the point of internship, I was like, I'm already working, I'm making a living, everything else is just part of the journey. So I could have chosen to become a GP, I could have chosen to freelance into whatever
course.
medicine allows me to do.
Yeah.
I could have chosen another career completely.
All together.
So you get to that point after community service where you now look into what it is that you really want to do. In fact, many of us do this by the time you're doing community service.
Right.
Some already attaching themselves to the specialty they want. Sometimes it's not as easy to do so. But yeah, following community service, if you want to specialize, then you attach yourself to the specialty. And when I say you attach yourself, I mean you will find yourself in a, and we're talking about now you're working in government. So you find yourself in a hospital which offers, where there's a certain discipline that you want, then you are employed to work in that department. So now, when you attach yourself to a specialty, after ComServe, or even, as I said before, ComServe, you choose a specialty in a specific hospital. It's usually a government hospital.
Okay.
And then from that point, you get your experience within the department, within the specialty, and then you work towards getting into a program. We call it a registration program.
Sure, so
where
you're not yet specializing.
You're not even specializing.
Yeah.
At that point, you are gaining experience. I did that. So I did that for 16 months.
Okay.
I was a medical officer for 16 months. And in that time, I remember, so I worked out a lot. So the time I was at gym and I was running on a treadmill, and I'm like, this is actually what I'm doing right now as a medical officer. I'm running, but I'm not going anywhere. So I'm not covering the distance, but I'm doing the work. And I was like, and that's basically what it is before you become a registrar. Yeah, no comrades, distances are covered there. And then you then apply to the specific teaching hospitals. So there's teaching hospitals which are attached to specific medical universities around the country. There's 8 of them. Well, there's 8 universities that offer medicine, and then there's hospitals attached to the different universities.
All right.
So this is where you will get into the program where you're now specializing. This will be a 4 to 5-year program, depending which specialty you're doing.
I've been counting. Khona la uthe 6, wathi 9, kune 2, kune 3, says 8 to 4 njalo. Mara mpekeni ungakanani, like mina I'm confused. Babukele makhaya, something is not adding up. Mhlawumbe uqale nje varsity ana 15, I don't know. Like really.
Well, the 6 and the 9, the 6 is in the 9. So
the 6 is in the 9. Yeah. Okay. Mara still, it's a lot.
It's a long journey.
It's a lot.
It's a long journey. So what I say is, so I've lived my life literally with end goals.
All right.
I've from primary even. Like, you're primary, like, okay, you're finishing primary. I had to go to middle school where I'm from. Then there's middle school, you look towards the end of middle high school. And then from that point, I planned literally my life to finishing medicine. And when I knew about there's ComServe, there's internship and ComServe, I was like, I was planning up till ComServe. I had no decisions made beyond ComServe. By the time I was in ComServe, I was still trying to decide what I want to choose. I had 3 specialties which I was looking at, and then I went with the one that I went with.
Why did you go with this one? You know, abanye abantu bathi these male doctors bayathanda okusengane. Bayathanda nje khona lento bayithanda. Like, why this one?
You know what? I get that question a lot. I get it social settings amongst my friends. I get it random strangers. I get it from even where I practice when I'm speaking to patients. Somebody will just be curious, like, so why the specialty? My love started when I was in varsity, right? I noticed. Here's the funny thing is, so when you're in varsity, you start with your basic the basics, where you're now learning your anatomy, your physiology, and all of those things. And then later on, you start doing the work according to a specialty, right? So now, in preparation for, and that's our clinical years, right? So in preparation for those clinical years, they would show us, like in the skills lab, they'll show us videos and stuff like that. 2 videos specifically that I remember from the skills lab. A pap smear was being done. And another one was a baby being born. I was in second year at that time, right?
You saw that.
So it was a video at that time. And I was like, I don't want to do this. I was like, this is not where I'm going. And then when we started rotating there now in obstetrics, I was like, can these 6 weeks just come and pass? I want to finish past this and leave, you know? I had interest actually in pediatrics. I actually wanted to be a pediatrician. So I did my obstetric rotation, and I actually enjoyed it. I found that I was in love with it. And to explain this, right, the beauty of seeing a baby being born, I started actually appreciating that. Apart from that, just seeing a patient, and this now over the years I started noticing, you know, this thing of seeing a person through their journey of pregnancy. This is what attached me to the discipline. And even after, you know, I said I had not decided by ComServe. By the time I decided, it was a dude. You know,
this is it.
Like, you can't run away from it. And I say this because many people would be like, stay away from this discipline.
Exactly.
It's going to frustrate you.
Also medically,
there's so many things here. Run away. I remember one doctor who was like, you will love something else. I'm here now, right? They were not wrong. At the same time, I don't regret choosing what I chose. I could have loved something else.
I'm sure right now in the comment section, the beauty of a child being born. When women go through that, it's nothing but pain. It's messy. Like, and then this doctor is saying the beauty. Yo, I know, right? Wow, Babugeli Amakaya, we are still here with Dr. Nakanyane. You know, he is a specialist in obstetrics and gynecology. You know, and he was just telling us briefly about his journey. Very important before we get into the topic. Yanam Khanje, you have got other interests outside of medicine. Particularly, he loves machines on wheels. Like, I love that. Like, tell us more about that.
So I've always loved cars growing up. I've always loved bikes growing up. But it's only a few years ago when I started getting into bikes. I've loved cars. I went through the whole internship phase. They call it the internitis.
Where doctors be getting...
They just, you know, you want to... you get that car that you can afford, but you can't really afford. Yeah, that's me. I did that. I speak against it now. I try and advise the younger dudes, but they still go on and do it. I don't know, but
They're
yeah.
cute.
Yeah. So for now, I just admire them. There are many cars that I love out there. I'm just admiring. I love bikes. I'm a biker. I've got two bikes now, and that's just where I free my soul. I've loved bikes since I was a kid. My mom said no bikes, no bikes, no bikes throughout growing up. At some point, she even told me that she would disown me if I owned a bike. So the day I got it,
'Cause it's dangerous.
it's dangerous.
Yeah.
She says it's not.
Oh, wow. Whoa.
Bike's only dangerous so it depends on how much you respect it. You respect your bike, then you're good.
Isn't that what they all say though? And
Yes,
then go
and-
that one.
So there's a saying that says there's old bikers and there's bold bikers.
Okay.
But there are very few old, bold bikers.
Oh.
So the bold ones are the ones who live on the like on the edge.
Yeah.
I don't do that. I ride my bike, I enjoy it, but I don't do like crazy things on the road. Yeah.
All right.
Yes.
Babugele Makaya niyabona ke you can still, be in the academics and still enjoy izinto, right? And this is a testament to that. Also very, very important, denial. But saying delay is not denial.
Yes.
Doctor's journey was quite, it was longer than others, but it didn't mean that he couldn't get there. He's there now. I mean, hey. So let us talk today. We're talking about abnormal uterine bleeding.
Yes.
It's a problem, you find young females, they have this problem. Also the elderly, they have this problem. They've been to doctors, they've tried things out. And take us through abnormal bleeding. What is it? What is it?
So, any female, I'm going to say female because it starts in puberty, in teenage.
All right.
So, any female that is of the reproductive age.
Okay.
So, from the time they start seeing their menstruations to the end, they are expected to have a period, bleeding period, which will be 3 to 7 days.
Okay.
That's what we consider as normal.
All right.
And
So
it will
anything
happen.
outside of that is
Anything
not.
outside that, you might need to just get
You
checked
might,
and see if there's something that can be done, especially if
right.
it's more, and it's
Okay.
quite heavy.
All
You
right.
may need to actually, that's considered abnormal. You
All
might be
right.
losing a lot more blood than you can actually afford to.
Okay.
And also the cycle is from the beginning of this period to the next one. It needs to be between 21 and 35 days.
Okay.
So you can have a 21-day cycle. You can have a 34-day cycle.
Okay.
Longer than that, it's abnormal.
All right.
And shorter than that, it's also abnormal. It needs to be checked. So there's also now, we also look at how much you bleed during a period.
Okay.
If it's really heavy,
Quantify really
now,
heavy.
heavy is very difficult to quantify. It's a difficult part. So we usually check with, so it's more of a subjective thing.
Okay.
Because we'll say more than 80 mils, but who's going to measure the
Yeah,
period
like-
blood every time?
But
right?
on a
So,
peg, how do you know
so
this is
yeah,
a
so it
guy?
goes back to now the number of pads, and you
Okay.
see if sometimes there's an increase in the usage of pads
Okay.
per cycle, and
Alright.
that change is something to note and
Alright.
maybe seek help for.
Okay.
Um,
So it's individualized.
So it's individualized,
What is different
yeah.
from the person's normal, what they know to be
yes,
normal?
exactly.
Okay, so not just because my friend uses 7 pads and I use 3 pads, now that one has a problem. Probably 7 is a norm for her.
It could be.
Okay.
But I don't. 7 is probably too much.
Wow.
Unless
But
it's per cycle.
Look at us asking a male.
I do know stuff about
About.
women. I do know a few things about women.
Okay.
But now, so the defining abnormal is it's not as straightforward,
Okay.
right? But I always say to patients, like if this doesn't seem like what you're used to, get
Then-
it checked. right?
I love that.
Yeah, so that's one thing to note.
Okay.
The other thing in terms of the cycle, some patients tend to expect, or people, let me not say patients, people tend to expect their cycle, the period to start on the 10th of every month, but months don't follow that cycle. So a 28-day cycle, you won't always be on the 10th. It will be on the 10th, and then 8th, and then 5th, and then 3rd, as such, right?
Okay.
A 32-day cycle, it'll always be a little bit further.
Yes,
A
of course.
21-day cycle, you might see your periods twice in the same month, and you might think that that's, but it's not really problematic.
Wow.
So certain normals might seem like they're abnormal, but they're not, right?
Nizwile angithi babukela emakhaya. Nizwile ne I hope ukuthi nizwile. Mangazwanga ngizo rewind ngithi ngizobuyela ngithi konke udokotela uthini. It can happen that you have them twice in 1 month, depending on how long your cycle is.
Yes. So now, when we come to now the causes of abnormal uterine bleeding,
Yes.
there's many. Yeah. So somebody decided, or a group of people
Yeah.
decided to group it into 2 parts.
Okay.
That's what we say structural, and then there's the other side where it has to do with a functionality of
Okay.
how the human works, basically.
All right. Okay.
Just to quickly go through it,
All right.
there's certain things that can grow on your uterus that will cause
So
bleeding.
the uterus, womb.
A womb, the uterus is a womb, yeah.
Okay.
So there's a few things that can grow that can cause abnormal bleeding.
All right.
There's what we call polyps. They grow inside the uterus.
Okay.
That causes heavy menstrual bleeding.
All
usually,
right.
sometimes you might bleed outside the uterus, outside of your periods, with a bit of spotting outside
Okay.
of your regular periods.
All right.
You will get a condition we call adenomyosis.
Sure.
I'm not going to try and explain what it is right
Cool.
now. It's a whole topic on its own. It'll cause heavy menstruations with
All
very,
right.
very painful menstruations.
Okay.
Usually when you get that, it's either endometriosis or adenomyosis.
Yo, there is that word.
Yeah.
Nizwile
Also
babukela.
that one.
Everyone, endometriosis.
Yeah, endometriosis that's also another topic on its own. That and adenomyosis are
It's
very,
a topic
very,
on its own.
yeah, very difficult condition to treat.
diagnose.
To
Okay,
diagnose.
how about the diagnosis? Because there's that feel that everyone suddenly, if they're having painful periods and they're heavy, they have endometriosis.
It's not necessarily that, but it quite likely will be.
Okay,
Especially the
understood.
endometriosis part.
Okay.
Usually I say, so endometriosis, it's usually very intensely painful periods. A lot of times the pains will start before the period starts,
Okay.
or it will go on after the period. And in some cases, the woman will not be able to, or the woman or the girl will not be able to go to school, work, will need to take a day or two, whatever, sometimes.
Oh,
ne?
okay.
In the severe
All right.
in the severe cases.
Okay.
When that is coupled with heavy menstruation, I'm inclined to go towards this now adenomyosis
route.
that I
Okay.
just mentioned. So adenomyosis is basically just endometriosis that affects the uterus,
Okay.
and it causes very heavy periods also.
All right.
And then you get your what we call leiomyoma, commonly known as fibroids.
That's a good one.
That
Nah, yeah,
one.
they're very
yes, that one will cause heavy periods often, and sometimes in severe cases it will cause what's this? There might be some heaviness in your abdomen. There might be some pain even, and then you also
Can
get.
it cause infertility?
It can affect fertility.
Oh, it can
so it
affect
can affect
it.
fertility. It may reduce chances of pregnancy. This depends on the size of the fibroids and also where they're located on the
Yes.
uterus. So we look at that also.
Okay. We'll get back into that, Babugeli.
Yes. And then the other one is malignancy. So
All right.
now these are the structural causes
Okay.
on the uterus.
Okay.
So which means that it's something that grows on the uterus. I always say the uterus does two things.
Okay.
It bleeds or it grows things.
Oh,
Sometimes it does both together,
sure.
right? So it'll either grow a baby or it grows these things that I've mentioned. And then with this, there'll be bleeding. Even with the baby, there's going to be bleeding at some
Yeah.
point, but we're not there.
We're not
The
there.
other side, so the other side of the abnormal uterine bleeding is the functional things,
Yes.
right? Coagulopathies. So we talk about abnormalities in the blood
All right.
that makes it easy to bleed. So
Okay.
sometimes we'll ask, when you hit something, do you see that you bruise easily? Do you have bleeding gums, bleeding nose? So
All right.
that, coupled with abnormal uterine bleeding, might lead us to think there's a medical cause for
Okay.
abnormal bleeding.
All right.
Ovulatory, that's when your ovulation, your cycle is not well regulated.
Okay.
Sometimes you'll hear doctors saying hormonal imbalance. So it's just a matter of your hormones not properly regulated. The hormones are responsible for your cycle, by the way.
So we
not
can
gonna
fix
get
that.
into
We can
It
fix
can
that.
be fixed.
Okay.
Yes, it can be
All
fixed.
right.
There's the endometrial part. Also, it's part structural because it's just the functionality of the endometrium. Endometrium is not maybe properly developed, and then you
Okay.
just bleed directly from the
All right.
the muscle of the uterus. And then you get, we say what's this? Iatrogenic.
All right.
So it means that this is caused by something that a doctor has given you, or a doctor has done,
Sure.
right?
So it's the doctor.
Or
kahle
a
kahle.
nurse. So it's it caused by
So
us.
it's kahle kahle. Somewhere in that problem
So
list.
that one, it's
doctor's
it's
feature.
caused either by medication you're taking,
Okay.
or maybe a procedure that you've had before, or
Alright.
something like that. Sorry.
Okay.
So there's that.
Okay.
And then the last one, we say N, which is, we say not otherwise specified. This is
Alright.
where we are now
So
at
we
our
don't
odds.
know.
We don't know. It happens. We don't know everything. We learn all of these things. We still don't know everything. There's a lot I still don't know.
So black magic, does it fall under N?
Hey, I don't want to say anything.
Okay, we're gonna leave that one. Makaya, there are certain things that even us professionals still don't know. Okay, now fibroids.
Yes.
This is la indaba yethu ikhona khona. How do you diagnose fibroids?
So, a whole diagnosis is made from, obviously during a consultation.
Okay.
The diagnosis is made from history examination and special investigations. That's
Okay.
usually the progression of things.
And what investigations are this? Like, can it be done in one sitting, or you're gonna need multiple sittings?
It depends on who's seeing you.
Okay.
Yes.
Ew.
So,
Shots?
no, I'm
Fire.
not firing any shots.
Yeah.
It's there, it's real.
Okay.
It's there, it's real. And I think people, it helps if people understand this, right?
Yes, definitely.
So I say it depends on who's seeing you
Yeah.
because you might be attending a clinic, you're
Yes.
seen by a nurse. The nurse will probably not be able to diagnose fibroids, but they can
see there's a problem.
suspect there's something then they'll
Okay.
send you
All
maybe
right.
to a hospital where you will
Perfect.
be seen by a doctor who can do a scan,
All right.
and then they'll diagnose it, right?
Okay.
You can go to a private GP, and depending on now, do they have a SONA or not? Obviously, from like I said, the diagnosis comes from history and examination, and
Yes,
then special
and-
investigation. So if they're taking their history and examination, they might suspect that there's a fibroid. Also depends on how big these fibroids are, because sometimes you can just from examination, you're like, these are fibroids, right? But you will still need an ultrasound to confirm that these are fibroids.
Okay.
So yes, a GP may be able to diagnose it.
All right.
It depends also on a lot of factors, as I mentioned. If they do a SONA, they may be able to see that there's a fibroid here.
Okay.
But quite often also, if they have a strong suspicion, they will refer patients to gynaes,
Okay.
where now, again, history examination, depending on how big it is, depending on how the picture comes, as they tell us their symptoms and everything, you may already have a high suspicion that this is fibroid.
it's fibroid.
On an ultrasound, you confirm. Now,
Okay.
this looks like a fibroid.
Okay. Now they've seen the GP. GP sent them to you. And then they get to you. You also tell them the very same thing that the GP told them. They've got fibroids. What now?
So, at this point, we come back to what is the problem,
Okay.
right? You went to a GP who found these fibroids. Were they bothering you? Was it an incidental thing?
Let's say they weren't bothering them.
Yeah. So it's now we question: is it bothering you? Is it causing any significant effects that maybe you were not aware of? For example, you asked if it affects fertility. Patients can come to me because they're struggling to fall pregnant.
Yeah.
There's a fibroid that we're seeing there.
Okay.
It is. It's significant. When I say it's significant, it's bigger than a certain size. It's located at the part of the uterus where we know that this will affect fertility.
Yeah.
In that instance, then we recommend that we remove the fibroid.
Okay.
That's not the only treatment for fibroids, but
So removing it is surgery.
that's surgery.
Okay.
Yeah, so we need to operate to have it removed.
Okay.
But our treatment in terms of, if we're looking at fibroids alone, you've got a patient, she's got fibroids,
Yeah.
right? First of all, like I said, you determine, do we need to do anything about it, right? So it's either bothers a patient or there's certain symptoms. There's heavy bleeding, or there's the issue of fertility,
Yeah.
or they just have pain, or there's fullness in their abdomen,
Yeah.
or it's so big that it's actually now, like, you can even see some people come and they think, they're like, am I pregnant?
It's like they're pregnant.
And they're
yeah.
that big. They can actually be so big that a fibroid is literally
Sure.
this huge. So it depends on a lot of those factors. So
Okay.
then we decide now, okay, we need to do something about this. The question now is, what is it that we need to do?
All right.
And we consider also, is this patient now, does she have children? Does she want children? Or is she done with having children?
Okay.
Right? Then we consider our options for treatment. There's medicines that we can give, there's certain procedures that can be done, and then there's surgery that removes the fibroid as
Okay.
it is.
Seemingly, ops and gynaes, that's what, that's the word on the streets, that they always want to cut. And a lot of patients or a lot of people are scared of going to our Dr. Nax. No, Dr. Nax, uzothi,
Let's go to
umese.
surgery.
Tell
So,
us about that.
I really can't speak for any of my colleagues,
Okay.
but from an ethical perspective,
Yeah.
I do believe that we have an ethical and a moral obligation to our patients to do what is right for them. Right?
Yes.
So what needs to happen is you need to determine if there's a need for surgery or not. Never just say, we'll operate, we take this fibroid out. There's certain fibroids, depending on their size and location, that you just look at, you're like, okay, it's there, you don't need to do anything about it.
Oh, okay.
I've seen patients who come for this thing, and then I scan them, there's a fibroid there.
Pick up something
Doesn't
else.
bother them.
Okay.
I'm like, this is not bothering you. You're fine. We're not doing anything.
All right.
Patients that are in their late 40s, for example, they are nearing menopause. They don't have symptoms. But I see this fibroid that's sitting there, and they just came for a different reason, or whatever the reason is. If I see that fibroid, I'll tell them, there's a fibroid there, but we don't need to do anything about it.
All right.
So you don't have to operate every patient that has a fibroid.
Okay.
Also, in terms of your options for management, there's certain medications that we can give that
Okay.
help shrink the fibroid.
Oh, okay.
There's certain procedures that can be done that can help shrink the fibroid. But
Okay.
what I usually say is, we also determine now, do you still want to have kids or not? If you haven't had kids before, you still want one or two more. I usually, and we need to take the fibroid out, or we need to treat the fibroid, then I will say we need to do surgery to remove the fibroid, because all these other modalities, or rather most of them, will somewhat affect your chances of falling pregnant negatively. So we usually stay away from them, except in patients that have completed their families.
All right.
So it's not always surgery. There's another procedure that can be done where they put in, they sort of block the blood supply to your uterus. You can always ask your doctor about this.
Okay.
Then that over time shrinks the uterus, the fibroid, I mean.
Okay.
And there's many other
So
options that we have. Yeah,
ways
there are
around
options. Yes,
this.
there are
Okay.
options. But I
And
usually
are
say,
these-
if you still want kids, we need to do an operation to take the fibroid out.
All right.
Yeah.
And are these options also available in government?
They are. They are. There's
Okay.
different institutions. This is, you must remember, before I became a gynecologist, I was
Yes.
working in government.
Yes.
So when I was training, I was doing these operations.
Okay.
So this is where I learned how to do these operations. I didn't suddenly learn them now in private. So
course.
as a registrar, there's a certain number of things that you need to do, certain number of operations and stuff like that.
All right.
So these operations I learned to do while I was a registrar. By the time I completed, I was able to do these operations confidently.
Okay.
Yes.
Now, Dokotela, tell us who is more likely to get fibroids?
Oh, phew. So there's different risk factors.
Okay.
Race is a factor.
So which one?
Being a black woman,
You're
unfortunately.
Babukela Makaya, I'm a black.
Yeah, being a black
woman.
woman puts you at a higher risk.
Okay.
Right?
Why? Do we know?
It's a genetic factor, but
Okay.
we don't know exactly why.
All right.
Diet might be a contributor also. We
Okay.
know that if you eat a lot of red meat and red wines, you are at a higher risk than normal to have fibroids, right?
My
But obviously-
professional girl is sipping on red wine. Yes, one.
But this obviously takes time. It's not
Okay.
something that you're not gonna eat red meat today and
Yes,
in
and
3 weeks you've got
suddenly
fibroids.
fibroids.
No, it
Okay,
doesn't. So it's something that
okay.
happens over a number of years,
Yes.
right? The other big thing is women who usually have their first pregnancy a bit later in life.
Okay.
They usually, by the time they have their first pregnancy, in their late 20s, early 30s. Now, this might seem
So
like it's not
20s is
late.
late. Are we saying 20s is
I'm saying
late?
when you're like almost at 30, the best time to have your first baby is probably between 20 and 25. Age-wise.
Sick. Oh, age-wise.
Age-wise, yeah. It's probably between
Okay.
20 and
Yeah.
20 and
My
25.
girl is in their 30s.
However, I'm not saying anybody must rush to get pregnant and everything,
Yes.
because it's a risk stratification thing. So you
Okay.
could fall pregnant at 20 and again at 23 and still get fibroids, right?
Yeah.
So it doesn't mean that just because you wait, it also, even if you wait until you're 30 to have children, it doesn't mean that you will have fibroids by the time some women even don't have children at all and they don't, get
have fibroids.
So
Yes.
it's not a definite thing that if this happens, that's going to happen.
Definitely. Babukeli Makhaya, I hope you're getting that. Ne? We are not saying gijima ke manje wena
Yeah.
ke. Uyoyenza abantwana ngoba ufuna ama-fibroids ayisebenzi kanjalo. Okay, ayisebenzi kanjalo. Nginganizwa ngiyaniphela nginganizwa nithi abodokotela bathize sijahela abantwana in our 20s because of i-fibroids. Yeah? Yes, doc.
Yes. So yeah, those are the big.
So
the big
pregnancy
ones.
is
Other
more.
things.
Is it pregnancy that is a protective factor? Abanye bafunda bathi late onset of sexual debut. So is it pregnancy or the sexual debut?
So it's actually the pregnancy. The sexual
Okay.
debut has nothing to do with this.
I'll have it. Ngiyayizwa, ne?
so-
Ngiyayizwa.
So it's the first time you actually fall pregnant. Pregnancy has a protective effect against fibroids. Some studies have actually shown that women that had like fibroids when they fell pregnant, after the pregnancy, the fibroids become smaller.
Sure.
So that can
Wow.
happen. Also.
Okay.
So pregnancy has a protective
Alright.
effect towards the fibroids.
And then any association with family history?
Yes. So sometimes you find that if your mother had fibroids, you have a higher chance of having fibroids.
Okay.
Your daughters will also have a higher chance of having fibroids. So
But it
there
doesn't
is-
necessarily mean bazoyithola.
doesn't necessarily mean that they will get it,
Okay.
but the risk is increased.
Of course. Wow, Babukile Makhaya, I hope that you are learning. You know, we are learning so much. I hope ukuthi nani you are getting in all of this information. Remember, we are empowering you to know more about your health so that you are able to take better decisions. And this is by no means a consultation. It's just a tool to give you more information, then when you're gonna do the right thing, and then you're gonna go and you're going to consult and see the healthcare professional, and they will refer you la ekumele ukuthi uye khona. Now, Dokotela, thank you so much for this. This was very, very insightful. Just in closing, what would your closing remarks be?
Specifically to fibroids, I will say, look, if it feels abnormal, get it checked. So if you've got heavy periods that you haven't had or that you didn't have before, you suddenly realize that your periods are a little bit heavier, there's discomfort. There can be discomfort during sex. I forgot to mention that the first time. Anything that you feel is out of place, just get it checked. It might not be fibroids, might be something else, but just get it checked. You might be having something that can be fixed. The other thing is, not all fibroids need to be operated, so it's important to also know that, but understand the need for the operation if there is a need for it. And yeah, I mean, it's always good to know. So I would also suggest, a little bit of reading. If you have the condition, do a little bit of reading. And obviously, you're not going to know what I know from whatever it is that you read. Do a bit of reading, research, there's videos. Whatever it is that you don't understand, bring it to your doctor. Have that conversation.
All right.
Yes.
And what is your take on Dr. Google? I went on Dr. Google and then bleeding, and I was like, yes, this is me, this is me, this is me, this is me. Is that sufficient?
I love and hate Dr. Google at the same time. So I always say, if I Google something medical, I will understand it for what it is, or for what is there. Even if it's somebody writing an article for a magazine or whatever, I will understand what they're talking about and I will know the facts. Right? If I was to Google something relating to, let's say, volcanic eruptions, I'll only understand what I read, and everything that I see might seem like fact to me, but there will be things that I don't understand. So I always say, if you're going to Google your symptoms, Google them, whatever concerns that come up, write them down. Take that to your doctor. Have that conversation. Don't even go there and tell your doctor that I've got this, I've got this, I've got that. No. These are my symptoms. This is what I read up on. My concerns are, am I having fibroids or not? Right? Do I have fibroids or not? And have that conversation. Let them make the diagnosis, right? And I'm in no way saying that you must leave the doctor to do everything for you. And no, work with them, make decisions with them, get involved. I always say an educated patient is always a better patient for me. I'm always happy to have that discussion. I'm always happy, any concerns that a patient has, I'm always happy to listen to them. If there's any myths that are there, we debunk and I tell them this is not true, this is not true, and this is what we're going with. A lot of people will also have, they'll always be influenced from friends and family, from social media. I saw this, I heard this. This one went to the doctor with heavy periods. They said it was this. So I think I have it too. They come to you and it's not there. Now it becomes a question of what is happening, So there's always that. But things will be specific to you. Whatever you read on Google, it will not necessarily be you.
Be you. So an educated patient is a better patient, and again, Nina Bubugeli Emakaya are definitely falling Guyoleo group Yama educated patient. Now, thank you so much, Dokotela, for coming. Just before Sivala, for our viewers that are around Gauteng, Dokotela utholakala kuphi?
So I am full-time in private. I'm practicing from two places.
Okay.
The first practice is in Tembisa.
Okay.
In Landmed Zamogul.
Okay.
They go there, they look for Dr. Nakanyane, they'll find me.
All right.
Second floor, room 4.
Nizwile ne-ethembisa ezama okuhle len mezama okuhle udokotela uyatholakala lapho.
And then the other one is in Centurion, Raslo.
Okay.
There's a new health facility, there's a new hospital that was built like 2 years ago. Raslo Private Hospital, that's where I am, but my practice is just next to it.
All
There's
right.
a wellness center, Raslo Wellness Center. It's in Centurion on the R55.
All right.
So my practice is also there.
Also the udokotela uyatholakala nase-Centurion. So babukeli emakhaya, it is up to wena ukuthi ufuna ukuya kuphi. Remember I told you ukuthi lana okuhle lapha kwe-holistic healthy living sinilethela only the best, and you are guaranteed to get top tier treatment. Dokotela, do you use appointment system, walk-ins? Isebenza kanjani?
It's always best to make an appointment because I'm not always available. It's two practices, so one day you'll find me that I'm at another practice. The other day I'll be at another practice. On a certain day I'm operating, so you may not always find me if you do a walk-in. You can find our contact details online. Right? If you Google Dr. Nakanyane, you're going to find a lot of things, but you will find a website. If you Google Pinnacle Health OBGYN, you will find us. If you Google Dr. Nakanyane or Dr. Nax, somewhere along your Google search, you're going to find it.
Because we're going to have this information showing on the screen. So you will just click. We are saving you the trouble. It's on Fagela Malinki, and that is where you can get Otokotela. Now, Doc, this is the very, very last one. This is purely for the viewers. You know, when we were reading your profile, came across something very interesting that you usually do along Women's Month, you know. Please tell us about that. Maybe mbukele makhaya nawe ungozithola usenhlanhleni.
So, you remember when we spoke about abnormal uterine bleeding, I mentioned malignancies as a cause. There's this one particular cancer, cervical cancer, right?
Cancer.
It's cancer of the womb.
Yes.
People say cancer of the mouth of the womb. That's cervical cancer. This is a purely preventable cancer. If we assess all the women around here, right? And we look for this cancer, we will find those that already have the cancer developed. We will find those that have lesions that can lead to the cancer, and then we'll find the healthy ones without this, right? So it's always important to, for these ones more specific. Well, obviously we will, if you've got a cancer and it's diagnosed, it will be great to be diagnosed. But it's always better to pick it up before it becomes a cancer. So we do pap smears for that. You've probably heard of pap smears. It's to pick up before the cancer develops. So abnormalities of the cells before the cancer develops. That's why we do pap smears. Now, it's a very important step in every woman. And we recommend that from the age of 25, you start with your regular screening.
What does,
So that's you going to either a GP, a clinic. You can see a nurse, a midwife. They'll do a pap smear, and then they'll give you the results and advise accordingly. Right? If there's a lesion that needs to happen, if there's a lesion that needs treatment, they will refer to a gynae or to a hospital. The treatment is instituted. If cancer is diagnosed, you will be referred accordingly. Treatment will be instituted. Right? So now, this is also something that I feel, you know, this is a cancer that should not exist. Because if we had, it's preventable, it's completely preventable.
100%.
So I offer from my practice on, I started this last year, by the way. I started it, got some sponsors in, and I did 40 of these screenings for free. So I do free screening in August. I do free screening.
So Kshuti, this is the pap smear.
This is the pap smear. So we do the free screening. There's labs that have collaborated, Lancet and SA Path have collaborated with us to process this specimen for free. Unfortunately, there is a limit to it. So last year we did 40. This year we're going for 100.
Wow.
So there will be days where I'm strictly just doing this.
Okay.
It won't be a consultation. It will just be us looking and doing the pap smears, and then if there's any abnormalities, we decide what needs to happen. So the screening part is completely free. Whether you have medical aid, whether you don't have medical aid, it doesn't matter. Same contact details that I mentioned. You contacted us. You contact us, and we will book you. We'll find space for you. And
wow, Babugeli Amakaya, if this is not the cherry on top, then I do not know what is. Dr. Nakanyane has this initiative, and Maunendlebe, you heard, ne, jump, don't run, jump for this opportunity. So Dokotela, does it age yomuntu wesifazane that can do this?
Yes,
like who can, if maybe you can just give us info.
I was still mentioning that. So from the age of 25, every woman is advised to start doing their cervical screening.
All right. Whether they've started their sexual debut or not? Does it matter?
If you're a virgin at 25, you don't need to do. If you've never had any sexual contact whatsoever, then you don't have to do it.
Okay.
But these are women who are already sexually active from the age of 25. They need to start their screening.
All right.
Patients, women who are HIV positive, however, at the time they're diagnosed, you need to do it. So if you're 23 and you're HIV positive, you find out that you're HIV positive, you need to start doing your pap smears.
Okay.
There are intervals in terms of when do we do this. We do it every, it's easier to say every 3 to 5 years or every year to 3 years. So every 3 to 5 years if you're HIV negative, every year to 3 years if you're HIV positive. This is because women who are HIV positive, they have a higher chance of developing cancer from this. Those that don't have it, it takes longer for the cancer to develop. So we need more frequent screening for the HIV positive women and not so frequent for the HIV negative women.
So Babugele Makai, if you fall in between this criteria, please jump on this opportunity. Once again, we're going to give you the details, and then say Zinhle zakho, yazi sinikile, siniphakelile. It is up to you to do the right thing. Now on my side, Dr. Z, wakamazibuko siyabonga kakhulu ukuthi nisiboleke indlebe zenu and your eyes. I hope ukuthi nifundile, and I really hope you're going to take this and not gatekeep. We don't do gatekeeping. Don't hold the information. Help another so that the other can also help another. Dokotela, thank you so much for coming.
Thanks for having me.
We really do appreciate it. And this is me signing out. Please, Babugele Emakaya, do not forget to like, to share, to subscribe. Ningakhohlwa futhi ukuthi niyakhona ukungena lapha kwi-page yethu Holistic Healthy Living. Put in your comments. Give us your questions. Tell us what you want us to talk about, and we will do just that. On my side of Dr. Z Mazibuko, thank you so much for joining us. Asibonane futhi ngesonto elizayo. Health is the greatest of God's gifts. Often, we take this for granted. GNF TV presents to you its renowned health talk show, Ezempilo, Holistic Healthy Living, where we aim to eradicate the lack of knowledge as far as health is concerned, bringing healthcare professionals to talk to you about all things health, physical health, mental health, emotional well-being. We've got you. Remember, your health is your responsibility, so do the right thing. Join us on Fridays from 5 to 6 here on GNF TV with Dr. Z.